Just as kids are heading back to school, a rare virus is sending hundreds of kids to the hospital. 10 states have contacted the CDC for assistance in investigating Enterovirus. Most of the cases that fit the rare virus's symptoms are being reported in the Midwest, including Illinois and Ohio. And the CDC says that these cases are just the tip of the iceberg when it comes to severe cases. So do we need to be concerned right here in West Michigan? Brian Hartl is an epidemiologist with the Kent County Health Department, joins us tonight to talk a little bit more about this. So tell us about Enterovirus. It's not unusual.
It is not, and actually enteroviruses are a family of viruses that cause a number of different illness, from respiratory illness to rash illness. And when people get a common cold in the summertime, or typically that's caused by enterovirus, that causes an illness that maybe is a little bit more severe than the common cold.
So tell us about this one. Why is this one so serious? Why is it sending kids to the hospital?
You know, we don't know at this point. All we know that this particular strain is more serious than other strains of enterovirus. So we know that it's causing these clusters of illness in these areas around the country that are causing kids to go to the hospital for care for severe respiratory illness.
Okay, so what are some of the symptoms that they're going through? And this is Enterovirus number 68,
D68, yeah, it's called D68.
Okay, so they've narrowed it down to the one that we're concerned about at this time. What are some of the symptoms?
Well, the main problem here is difficulty breathing. So people will have a very difficult time breathing. They'll wheeze. Sometimes they'll have a high fever, and sometimes they can develop a rash. But it's really the problems breathing that is what sends the kids to the hospital. Breathing,
and I read too, it's really bad news for kids that have asthma.
Exactly. So anybody with previous breathing problems, asthma, parents of those kids should be particularly concerned about this virus. So if your kids get a common cold or start, becoming sick with respiratory symptoms, then be concerned and call your doctor.
Call your doctor or get into the hospital, I guess, as soon as you can.
And make sure they take their medication.
What can they do? What is the medication? Is there a vaccine for this?
There's no vaccine for it, and really there's no specific treatment for enterovirus. It's mainly supportive therapy to treat the symptoms, treat the fever, the cough. They have the kids go on oxygen to help them breathe, but there's no specific treatment or vaccine for the
So
virus.
Basically, if the kids have to go into the hospital, it's really just monitoring their condition because and helping them with some oxygen masks.
Yeah, and to this point, no one has died that we know of, and typically enterovirus doesn't cause severe illness where a patient will pass away.
What about West Michigan? That's the good news, and that's something that we really need to repeat. This has not been fatal. It is, but it is certainly sweeping throughout the Midwest. Michigan hasn't seen any cases yet that we've heard of.
Not that we've heard of, no.
Should we be concerned?
I think in the situation you should always be concerned that eventually we'll see cases in the state of Michigan. I think the fact that it's not a fatal disease at this point shouldn't raise the flag too high, but we need to know and take those precautionary measures. Kids go back to school, it's becoming flu season as well, so anytime you get that many kids in a congregate setting, you want to make sure they know about hand washing, know about not touching their eyes and their hands and their
That's the key, right? It always comes back to the hand washing and making sure, because that's how it spreads, right?
Exactly.
Sneezing, touching, and getting it somehow into your own system.
Exactly, yep. So I know kids aren't the best at hand washing, but parents, and school teachers and those people can really reinforce how important it is. This just brings up that point. How important is this for kids to do that and not touch their eyes, not touch their nose, and really prevent illness from spreading.
Okay. Brian Hartl, epidemiologist with the Kent County Health Department. We appreciate you stopping in to talk about this today.
Thank you.